What is autism spectrum condition and how is it diagnosed? This question is crucial in the world of healthcare. By understanding the diagnostic criteria, we can better identify, support, and treat those living with autism spectrum condition. The diagnosis of autism spectrum condition is typically made based on standardized criteria outlined in two primary diagnostic manuals, the ICD-11 and the DSM-5. Starting with the ICD-11, the International Classification of Diseases 11th revision, it outlines the diagnostic criteria for autism spectrum condition as persistent deficits in social communication and interaction across multiple contexts. These deficits may manifest as difficulties in initiating and maintaining social relationships, deficits in nonverbal communicative behaviors, and challenges in understanding and appropriately using verbal and nonverbal communication. Additionally, the ICD-11 criteria include restricted repetitive patterns of behavior, interests, or activities. These patterns can take the form of stereotyped or repetitive motor movements, an insistence on sameness or highly restricted fixated interests. The ICD-11 also notes that these symptoms must be present from early childhood and cause significant impairment in social, occupational, or other important areas of functioning. On the other hand, the DSM-5, the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, also outlines similar criteria for diagnosing autism spectrum disorder. Just like the ICD-11, it highlights persistent deficits in social communication and interaction, as well as restricted, repetitive patterns of behavior. However, the DSM-5 takes a slightly different approach in its criteria. It emphasizes deficits in social emotional reciprocity and the development, maintenance, and understanding of relationships. The DSM-5 also insists that the symptoms must be present in the early developmental period and cause clinically significant impairment in key areas of current functioning. So, while both the ICD-11 and DSM-5 share many similarities, they also have their unique nuances. To summarize, both the ICD-11 and DSM-5 criteria for diagnosing autism spectrum condition focus on persistent deficits in social communication and interaction, along with restricted repetitive patterns of behavior. However, the DSM-5 places more emphasis on social emotional reciprocity and the development of relationships. Both manuals stress the importance of these symptoms being present from a young age and causing significant impairment in key areas of functioning. However, the DSM-5 specifies that these symptoms must cause clinically significant impairment in current functioning. It's important to remember that the diagnosis of autism spectrum condition should be made by qualified healthcare professionals. This diagnosis is based on a comprehensive evaluation of the individual's symptoms, developmental history, and functioning across multiple domains. In the end, understanding these diagnostic criteria is vital in the journey towards improved support and treatment for those living with autism spectrum condition.